Hi, everybody. Thanks for joining the webinar today. This should be pretty short and sweet because I'm not going to sugarcoat anything. You're going to get it as dense as we possibly can. So yesterday, I told you that I would basically share the 3 things that I've noticed that really move the dial on profitability for dentists. I guess I don't have to tell you how so many dentists are working harder than they realistically need to. And we want to make sure that you can spend that time with your family, retire early. Like I said, I probably don't have to tell you guys that much. So let's jump into the 3 tips that I have seen for improving your profit margins. So the first one is definitely strategic scheduling. To evaluate the efficacy, let's say, of your scheduling, what I want you to do is go into your calendar and count all of the unscheduled time. Now, this should be a metric that's pretty familiar to you. However, what I want you to do differently is categorize the unbooked time by the amount of time that's unbooked in that sort of run. So you're going to put 10-minute unbooked times in, tally them there. 20-minute, same thing, tally them there, 30-minute, etc. Why are we doing this? Like I said, you pretty much always see the unbooked time all lumped together. However, they have totally different root causes. So if you have, let's say, 6 10-minute unscheduled blocks, the reason for that is very different than if you have one 60-minute unblocked time, and that's the information that's really missing. So if you have a lot of short unbooked time, what I would recommend doing is blocking off different hours in your schedule for specific procedures. That's going to help you maintain those larger bookable blocks, because frankly, the 10-minute unbooked times are like worth almost nothing to you, and it just takes away from potential patient time. Now, if that's not the case, you have really efficient scheduling. You have, let's say, one 60-minute block every day that's free, and it's not lunch. Then that's the time to hit your recares and take a look at your treatment plan acceptance rate. So with that, let's pop into number 2. Actually, does anyone have any questions about strategic scheduling? If so, go ahead and drop it in the chat. I'm going to pull that up. It looks like we do have one question here. How do you block the time? That's a big question, but I'll try to answer it as succinctly as possible. Part of it depends on the specialty or generality of your clinic. So if you're wanting to get more of those major procedures in, then you're going to want to make sure that you're really holding those times sacred. If you're a growing clinic, make sure that you block time for new patient appointments, for example. So that is sort of the quick and dirty of a very high level of how to schedule block, but it really depends on the goals of your clinic, and just making sure that you're putting time aside for that. If you have other questions, don't feel like you have to get them in right now. You can either book a 15-minute session with me or just drop them in the comments. So going forward, treatment plan acceptance and presentation. You should have fairly high treatment plan acceptance rate, but this is pretty demographic specific. So if you're in a dental focus group, and if you're not in one, I highly recommend joining one, but that's a separate webinar. That's going to give you more of an idea of where your demographics align. But when you're doing patient treatment plan presentation, there's sort of 3 big things that I see that make a big difference in the bottom line. And the first one is really simple. You've probably heard it 1,000 times. Ask the patients what their priorities are right from the get-go. So for me, I have 3 things. Can you rate these in order of importance to you? Aesthetics, value, and longevity. Now, don't feel like you have to take mine. You can customize this, but making sure that you know what the patient priorities are going to, number 1, help you speak in a way that speaks to them. And then 2, make sure that if there's multiple treatment plans, to say, okay, this one's going to give you the better aesthetics. However, the better value is treatment plan number 2. And then, of course, when you're presenting the treatment plan, make sure that you are talking about the patient and insurance portions. Make sure that you've done a pre-authorization or at least have those estimates. I know that I'm going to get a bit of pushback because I see like little hands going up here. Yeah, yes, every time. And this may mean that you accept fewer insurances. Some obviously have more exceptions than others, and that makes estimates really difficult. And in the end, if you don't have a good insurance estimate, you're probably, I'm not going to say probably, but there's a very good likelihood that you're going to be discounting and eating that cost, which can really sink your ship fast. So letting them know in advance and doing the work to make sure that you have good estimates for them. Now, in that same vein, because you now have good estimates for them, you can present the payment options at that time. Okay, you can pay in cash, or we have care credit. I love care credit, which brings us into the third tip, AR management. You cannot pay this person enough, in my opinion. So many dental, oh, sorry guys, I jumped straight ahead. Does anyone have questions about treatment plan presentation and acceptance rates? I know this is something that's covered a lot, but it really can't be understated. We could host a completely separate webinar on this. So we'll just leave it at that and go on to AR. Your questions are important to me, but they're big. So accounts receivable. Like I was saying, you can't overpay this person. Often, like maybe I could get actually a show of hands. Who has a dedicated, specially trained accounts receivable person? It's good, it's good. How many people hired them as an accounts receivable person? Less. This is such a specialty role, and dental clinics often get so caught up in production, but there's no easier way to sink your ship than to run out of cash. You cannot pay your employees on production. Would that we could. So there's two things that I see make a big difference in decreasing AR. The first is same-day patient payments. And again, we're setting the precedent already in the treatment plan presentation. So when the patient shows up, they've either already applied for care credit or they've come with their money in hand. So same-day patient payments, it's so important for the patients because the longer they sit in AR, the less that accounts receivable is valued at. And a lot of the time, banks won't even consider accounts receivable from non-insurance entities that are over 90 days. They consider them that valueless. So let that sink in. Same-day patient payments, if you need to train your staff on having money talks, do it. It's so worth it. And then the patient has clarity and they've set their expectations. The second is first-time claim acceptance. I think it's really easy when you're getting in a hurry to just like send off the paperwork. Maybe you miss the radiographs, but the delay is huge. I mean, it could take 6 months if it's not collected on that first time to get the money that you're owed for what has been produced. And most dental clinics are not in a position to swallow that comfortably. In addition, it's also going to really bog down your AR person or your insurance processor to try and track that down, get the correct paperwork after the fact. So I would definitely create a standard operating procedure outlining how to get that done. Does anyone have questions on accounts receivable? See it. Who discounts? Who discounts? If you work with me already, you know my opinion on discounts. I try to be really intentional about my discounts. Doesn't mean that I don't give them, but what I do is I break it up. I think if you don't have intentional discounts, then you end up giving, 100 people 10% off. Well, when you take that into totality, you could really do a lot of good with that. You offer a senior's day or a kid's day. You offer someone a completely new smile with the discounts a lot of patients don't necessarily even appreciate or need. I know that as dentists, you help people, you want to make people happy, you know what a difference it makes, but really reining in that desire, I guess, to serve, to make sure that it's being put where it's going to make the most impact. And often that is reducing the number of discounts that you give so that you can give that, that sort of dollar amount, whatever that target dollar amount is, back to the community. If you have any questions, I'm going to cut us off here because I know that you guys are super busy, but feel free to schedule a time with me. I will drop a link in the recording. Thanks. Have a great day.